Hello, Janisa, we are live now. You can start.
Okay. Hello and good afternoon, everyone. Myself, Janisha, and on behalf of Optometry team, I would like to welcome you all. It's my pleasure to be a moderator for this live session. Starting with a short introduction of an e-learning program, which is initiated by Optometry team, where optometry-related topics are discussed and interact briefly. This session is live, and if you have any queries regarding the topic, you can write them down in chat section. We will be discussing them after the presentation. Before starting the session, may I briefly introduce our today's presenter, Ms.Dhiwani Patel. She is a first-year student of Bachelor of Optometry from Hari Jyot College of Optometry, Neisseria, Gujarat. She will be presenting on Ocular Bacteriology. On behalf of Optometry team, I welcome you, Dhwani. So shall we start, Dhwani?
Yes.
Okay.
Thank you. So, good afternoon to all. I guess everyone would be familiar to the word bacteriology, which generally means study of bacteria. But ocular bacteriology is the study of bacteria that causes eye infection, that is ocular infection. So, before starting, I would like to share my motive behind the selection of this topic. So recently I had a talk with my friend. We were just discussing about a syllabus, and suddenly she said me that why we have to study microbiology, bacteriology and virology. We are going to become an optometrist. Then what is the need of these subjects in our field? We only, I guess everyone would be having this question. Some of would be knowing the importance of it, but I guess everyone would be having this question that we just have to deal with specs and refractive errors. But here is the answer for each and every one of you. Importance of bacteriology in optometry. So bacteriology is important for us so that if any patient having any kind of infection comes to us, so we can easily diagnose and treat that patient. Generally, we can also give that patient an overview that you are suffering from this infection. Imagine if we don't know bacteriology or microbiology and a patient comes to us with any infection, then how would we help that patient by telling her that he or she is infected by this bacteria or this is the infection in his eyes. So bacteriology is similarly equally important in our field. So today we are going to discuss some of the bacteria that cause ocular infection, that is infection of the eye. There is a just general overview of these bacteria. So first of all, we will start with Staphylococcus. It consists of about 27 species and play a major part in ocular infection. Because it is a major part, that is most of the ocular infections are caused by Staphylococcus bacteria. So if we see, generally most of the infection of the eye are due to this Staphylococcal bacteria only. Now you all can see that it looks like a grapes. From the image you all will be able to make out that why it is so. Let us see its morphology. They are spherical in shape, 0.5 to 1 micrometer in size, in grape-like clusters. They are arranged in grape-like clusters so that the appearance of them is grape-like. And their characteristic is they are non-sporing, non-motile, and capsulated. Non-sporing means they do not reproduce by sporing method. And capsulated, everyone would be knowing that there is a characteristics of bacteria. Some bacteria only have this characteristic that they have the capsule around their body, which provide resistance to them. Now let us see what all ocular infections do Staphylococci give us. So here is the following list: ulcerative squamous blepharitis, hordeolum, orbital cellulitis, conjunctivitis, and keratitis. These are the following ocular infections that Staphylococcus cause in our eyes. So what is Staphylococcal blepharitis? It is matted hard cluster around the eyelashes. This cluster may cause difficulty in opening eye during morning, and if we force it and the cluster gets removed, then it will leave small ulcers, and sometimes it may also bleed, and there is a loss of eyelash also if we force it. And the another one is hordeolum. Hordeolum is an infectious pyogenic swelling of the eyelid. Pyogenic means pus-forming swelling. It is due to the obstruction of ducts of sebaceous gland. So if there is an obstruction of sebaceous gland, pyogenic swelling will be seen. And along with that, localized infection is also caused. So it is one of the infection that is caused by Staphylococcal bacteria. Now, orbital cellulitis. Orbital cellulitis is inflammation of eye tissue behind the orbital septum. That is, there is an inflammation behind the eye tissue that is behind the orbital septum, referred to an acute spread of infection into the eye socket from either the adjacent sinuses or through the blood. It can be spread acutely by eye socket or by any of the either sinuses or through blood. When it affects the rear of the eye, it is known as retroorbital cellulitis. Now, diagnosis. It is obvious that whenever there is a infection, we have to diagnose it. And generally, we know that it is a bacteria, so we have to gram stain it or culture it. By that, we can make out that which bacteria it is. So, demonstration, it is staphylococcal can be demonstrated by examining a gram stain of the specimen. Culture of blood agar nutrient agar plate are examined for characteristic colonies. So in blood agar, we can colonize them and we can see the characteristics. And for further identification of this species, we have to do biochemical tests so that we can come to know it is which type of species. Now treatment. Talking about treatment, 90% of stain are resistant to penicillin. So most of staphylococci are resistant to penicillin. So penicillin is not much effective for staphylococcal infection. So, but the important fact is that it is most sensitive to methicillin, cephalosporin, and flucloxacillin. So by using these drugs, we can treat staphylococcal infection. So now the another one is Neisseria. The most important fact about this bacteria is it is the strongest bacteria. Now everyone would be thinking that why did I say this? Because it has the tendency to carry 10 raised to 5 times of its own weight. So it is called as the most strongest bacteria. Now grouping of Neisseria. Neisseria has many species. So following are it, that is N. sicca, N. pharensis, N. mucosa, N. flava, N. meningitis, N. goronia. But among all this, we are going to see N. meningitis and N. goronia. These are the images of N. goronia and N. meningitis. Now, what are the ocular infection? Gonococci. Now, the name gonococci is due to because the species is goronia and the type of the bacteria is cocci bacteria. So it is termed as gonococci. So first of all, let us see which are the ocular infections. So there is ophthalmic neonatorum. It is most common cause of conjunctivitis in newborn. So if there is a newborn infant or newborn baby, you can see such type of infection in that baby. Gonococcal conjunctivitis in the teenagers and adults due to autoinoculation or accidentally transmission. Autoinoculation means spread of infection from one part to another parts of the same body. Because of this, the infection is spread and sometimes it could be accidentally transmission of this disease. And talking about meningococci, so similarly, the species is meningitis, and the type of the bacteria is cocci. So it is termed as meningococci. Now the ocular infections is conjunctivitis, ulcerative keratitis, and endophthalmitis. So ophthalmic neonatorum, bacterial inflammation of the conjunctivita occurring in infants. So usually this is caused because carelessness during the time of birth, and sometimes it is seen that if there is a genital infection of the mother, so while the baby is delivered, it is caused by the connection of the genital area with the baby. So because of that, there is the infection. Now endophthalmitis, it is the condition in which internal structure of the eye are invaded by replicating organism. As we all know that our human body has a tendency to defend any of the things that is foreign, that is foreign bodies. As soon as it comes in a body, it gives a defense mechanism, and the most important defense mechanism is inflammatory. So because of this, there is an inflammation, and that involves all the tissues of the eye. So endophthalmitis is due to the condition of invaded organism that replicate continuously. Now again, for the diagnostic, as this is the bacteria, so for this there is direct demonstration of the organisms in gram stain. Smears is something that is a mark or a spot on a greasy substance. So if we diagnose this, we can see the smears. And culture. In culture, we have to give immediate inoculation in enriched selective media and incubation at 37 degrees Celsius in a carbon dioxide enriched atmosphere. So each and every bacteria needs some culture for growing. So we have to give such media so that we can grow that bacteria and come to know that which type of species or which type of bacteria it is. And now we have to see serology. Serology is generally a study of diagnosis of blood agar or blood serum. So in that there are ELISA. ELISA, I think so it is the famous test, that is enzyme linked immunoassay. It is commonly used to detect antibodies. So we can detect it by antibodies. Immunoblotting is also one of the method by which we can diagnose the bacteria. Radioimmunoassay are all available for detection of IgG and IgA antibodies. So like this also, by detecting the antibodies, we can come to know that which type of bacteria it is. Now treatment. Penicillin is the drug of choice for meningococcal infections. For patients allergic to penicillin, chlorophenicol and cephalosporin can be used. So penicillin is generally used, but if some patient have allergy to penicillin, instead of penicillin, we can give them chloromethophenol, cephalosporin. And for gonococcal infection, penicillin is effective, but recently it has seen that the stains have developed resistance against penicillin. So for that, we are recently using tetracycline, erythromycin, and cefoxitin because it has been proved effective to treat gonococcal infections. Now, coronary diphtheria. The most important characteristic of this bacteria, that is it pleuriomorphic, that it has many characteristics. So it is termed as pleuriomorphic bacteria. Now, looking about the morphology of this bacteria, the diphtheria bacillus is a slender rod with a tendency to club at one or both ends. So here you can see that it is rod shaped, and the bacilli is pleuriomorphic. They are gram positive but tend to decolorize easily. Even though they are gram positive, they easily decolorized when they are stained, and their measuring is approximately 3.6 into 0.6 micron. Now, what are the ocular infection caused by coronary bacterium? So here is the answer to that. Membranous conjunctivitis and plasia of extraocular muscle. Now, what is plasia of extraocular muscle? Plasia is the paralysis of extraocular muscle. That is, there is everyone would be knowing extraocular muscles. So if the person turns the eye because of the paralysis of extraocular muscles, there is a pain, severe pain in the patient's eye. Now talking about acute membranous conjunctivitis. So here is the characteristic of it. It is characterized by unilateral or bilateral conjunctivitis of eye with presence of either pseudo or fibrinous membrane, either on palpebral or bulbar conjunctivitis. So there is unilateral or bilateral conjunctivitis of the eye, that would be either pseudo or fibrous membrane, and it can be either on palpebral or bulbar conjunctivitis. And if it is a through membrane formation, So on peeling that, there will be bleeding, and most causative organism for this infection is coronary bacterium diphtheria. Now again, for the treatment, uh, for diphtheria there is a specific test, that is tick test, a test for previously acquired immunity to diphtheria using ectodermal injection of diphtheria toxin. So the ectodermal injection is given of diphtheria toxin to diagnose this in this test. And the specific treatment for diphtheria consists of antitoxin and antibiotics therapy, which is usually used for some bacteria. Now microbacteria. These have the property to resist decolorization as they have mycolic acid in their cell wall. Because of the mycolic acid, they does not get decolorized after staining. This is the important characteristic of mycobacteria. Now there are two types, Mycobacterium tuberculosis and Mycobacterium leprae. Now Mycobacterium tuberculosis, I guess everyone would be familiar to this tuberculosis. So they are 3 into 0.3 micrometer in size, arranged slightly or small groups, straight or slightly curved rods. They are non-motile, non-sporing, and non-capsulated. Long filamentous branching forms may be seen sometimes. So from the image, you all can make out that they are filamentous and long. They do not reproduce by sporing, and they are non-capsulated. So they don't have capsule around them. Now, what are the ocular infections caused by this bacteria? That is tuberculous ulcer of the lid margin, tuberculosis nodule disabling, chalazion interstitial keratitis, anterior and posterior tuberculosis scleritis, tuberculosis of the uveal tract, tuberculosis of choroiditis. Following are the infection that is caused by Mycobacterium tuberculosis. So, eyelid tuberculosis granuloma. So, in this, that it is unilateral and indigenous. That is, the infection proceeds gradually but with a very harmful effect, and it manifests with a violet brown non-tender mobile nodules. The nodule may ulcerate after is often accompanied by pain and discharge. After the nodule is formed, it may ulcerate, that is the ulcer will be formed, and there would be pain. And in complications, if we see, that is trichiasis and enteropian formation. Now, what is trichiasis? Trichiasis is ingrow or interversion of eyelashes, that is to turn a structure into itself, and enteropian formation, that is the eyelids fold inwards. In this condition, the eyelids fold inwards. So this is the some characteristic of this infection. Now, interstitial keratitis. It is the inflammation of a corneal stoma without the involvement of primary epithelium or endothelium. In most cases, the inflammation is an immunomediated process triggered by the antigen. Tuberculosis scleritis. Scleritis means the inflammation of sclera. Mostly it is present as an anterior scleritis, while posterior scleritis is rare. So from this we can make out that anterior scleritis is more prominent than posterior. Localized focal elevated nodules of the sclera are necrotizing. That is the death, serious bacterial infection that destroys tissue under the skin. Necrotizing, that it destroys the tissue under the skin because of the severe bacterial infection. The sclera may be infected by direct spread from a local conjunctival or choroidal lesion, or more commonly by hematogenous spread. So it can be caused with the direct spread of local conjunctival or choroidal lesion, or more commonly by hematogenous spread. Now, stye and chalazion. What is style? A small painful lump that can pop up under the eyelid or at its edge. So we can see in the image that it is a small lump above that eyelid, and it is caused by bacteria which infect the eyelid root or a hair follicle. So it infects the hair follicle. And chalazion, a painless bump. See the difference. In sta it is painful, and in chalazion there is a painless bump on the eyelid that grows when an oil gland gets coggled up. Here the oil gland is coggled up. It is caused by an inflammation of the eyelid's oil gland. Now again we go to diagnosis and treatment. So for diagnosis of this mycobacterium, uh, demonstration of the acid-fast organism by microscopy after staining with Ziehl-Neelsen stain. This Ziehl-Neelsen stain is mostly used for the identification of mycobacteria. So this is the most common diagnostic method in the mycobacteria. Isolation of N tuberculosis in culture, so we have to culture it. Western blot, a confirmatory test available only in specialized laboratory, is also done. In Western blots, that is, it just identifies the protein molecules. So by identifying the protein molecules, we can make out of the bacteria. And cell culture techniques have also been developed. Cell culture techniques also can be used for the diagnosis. And for treatment, systemic chemotherapy is a must even in cases of ocular tuberculosis. So in ocular tuberculosis, chemotherapy is must. And some anti-tuberculosis drugs used at present are isoniazid, ethambutol, rifampin 1, and streptomycin. So these are the following drugs that can be used for treatment. Now, Mycobacterium leprae. This organism was first demonstrated in 1874 by Hesen, a Norwegian doctor. So this was first demonstrated by a Norwegian doctor. And they are acid-fast bacilli arranged in parallel bundles or in globular masses are referred to as cigar bundles. So here you can see the image in this globular masses are distributed. So this type of arrangement and this type of image is termed as cigar bundles. Now, ocular infection caused by this bacteria is non-specific conjunctivitis, punctate or interstitial conjunctivitis, secondary corneal ulcer, and scarring, acute iritis, scleritis, and episcleritis, chronic granulomatous uveitis. So, episcleritis is a transition condition with pain and local redness, often as a precursor of systemic ENL reaction, and results spontaneously and completely. Tropical steroids may be used. So you can see here in the image the example of episcleritis, and scleritis is a severe condition, often bilateral. Scleritis may be nodular or diffuse with or without acute iritis and with or without sclerosing keratitis. In combination with iritis, sclerosuveitis, there may be haziness of the cornea and secondary glaucoma. So for these are the following infection that may be followed with scleritis. Now anterior uveitis. Acute or chronic granulomatous uveitis may be associated with iris or angle granuloma, mutton fat capice, and posterior sinusal broad base. So here is the image for anterior uveitis. That is the inflammation of the uvea. Diagnosis and treatment for this is the acid-fast bacilli can be strained by Ziehl-Neelsen method. As I said that this is the method commonly used for mycobacteria, and histology, biopsy, and lepromin test. So these are the following tests to diagnose this bacteria. And for treatment, the WHO has recommended a multi-drug therapy. So there are many drugs which are used for the treatment of Mycobacterium leprae. Now actinomycin. The interesting fact about this bacteria that the smell that we sense during rain is due to this bacteria, that is actinomycetes. Now let us see the morphology about it. They are gram-positive, motile, non-acid fast bacilli, and form thin, long, irregular branching filaments, which gives a beaded appearance. So here you can see that it is filamentous, long and irregular, and branching also we can see in this image. And they are gram-positive, motile, and non-acid fast. Now, ocular infection caused by this bacteria is lacrimal canaliculitis, diclocystis, conjunctivitis, corneal ulcer, and post-operative infections. Now, bacterial keratitis or corneal ulcer. An infection of the cornea that is caused by bacteria. It can affect contact lens wearers and also sometimes people who do not wear contact lens. So generally, some of them we know that have the infection or allergy because of the contact lens. So along with that, this bacteria can also affect. So this is corneal ulcer image we can see. Now, diclocystis, it is the inflammation of lacrimal sac, often caused by obstruction of nasolacrimal duct, followed by bacterial infection. So it is along with the inflammation of lacrimal sac, bacterial infection is also caused in this. Now again, diagnosis of this bacteria, that is direct microscopy. So by culturing it, we can see direct microscopy or by culture. And the another important technique is fluorescent antibody technique. So here we come to an end of the talk of this, of some of the bacteria that cause ocular infection. But what if we avoid the infection before causing it? So what should we do to prevent this infections? What are the preventive measures to take this uh, to avoid infection? So here are some steps. First of all, the most important thing is avoid direct contact with the eye. So wash your hands, especially after touching dirty surface, because we don't know which type of microorganisms are settled on which type of surface. So before touching your eyes, just wash your hands. Avoid rubbing your hands excessively. Now we very well know that some of them have the habit of rubbing their eye continuously if there is itching. So please don't do that. It is also harmful. And if you use contact lens, always clean them and store them correctly. So people using contact lens should take care of that, because if we keep contact lens somewhere and then we use, then we don't know which type of microorganisms have settled on it. So before using them, just clean them and avoid exposure to smoke, chemical fume, and other irritating substances. So direct contact to such type of particles can also cause infection. So we should avoid that. So if there are any queries, please tell.
Okay, thank you, Dhwani. It was a very wonderful presentation. Okay, so now we will move to our discussion part. I think, Dhwani, there are no questions yet we have got, so we can wait for some time. Dhwani, there are no questions.
Okay.
So thank you, Dhwani. And on behalf of our Optum team and our audience, I would like to thank you for sharing your knowledge and for this informative presentation. And also thanks to our audience for being supportive as well as interactive. And on this note, we will end this session. Stay home, stay safe.